We are going to get started. I want to welcome all of our guests, all of our business partners. Welcome to the Wednesday night call. And there were two people who requested this topic. So feel free to request topics at any point. Like you can request a topic 4 hours before our meeting and we'll make it happen. So, Maggie Carter and Dr. Joy Smith, they recommended that we talk about CBD and our immune system and really hone in on some things that are going on in our world, right? With this new variant, Delta variant, with the Lambda variant of COVID, and just protecting our immune system as a whole. So CBD and your immune system is our topic. I want to welcome everyone. I'm Dr. Rita McGuire. I am the Chief Medical Officer here at Wakana. You can just call me Dr. Rita, and you can absolutely, as we are moving through this presentation, you can put questions in the chat box and I will address those answers or address those questions with answers along with my esteemed medical advisory board. So what is the human immune system? You know, we hear it all the time, but sometimes we have to really understand all of the important parts of our immune system, and we have to understand all the things that we need to do to make our immune system the strongest it can be, right? So I want to first say that don't think that you can just put a couple of drops of CBD under your tongue and call it a day. We really want you to do a lot more than that, right? Embrace a healthy, active lifestyle that includes getting enough sleep, which I'm guilty of not getting enough sleep sometimes, working out, being active, drinking your water, taking your products, eating a really healthy diet, plant-based if you can. So all of these things collectively help our immune system to be strong. And we want our immune system to be strong so that we can fight off infections. We can fight off viral infections, bacterial infections, fungal infections. We can even fight off cancer cells from a lot of, we'll talk about autoimmune conditions. So when we look at the immune system, our body has an entire system, which is the immune system, to help us fight off and ward off viruses, bacteria, and other infectious diseases. These are some of the glands and the organs that make up our immune system. The lymph nodes, our appendix, our bone marrow, our tonsils, our adenoids, our thymus, our spleen, and part of our small intestines, which is the Peyer's patch. This system is very complex. You know, it's made up of cells and tissues that are on constant alert. They're on constant alert looking for pathogens, looking for bad actors that can come into our body and take over and cause us to be really, really sick, okay? So white blood cells or leukocytes, they are really the important part of our immune system that really helps to ward and fight off infections. You may know of some people that have leukemia, right? Or they have a blood cancer. Their white blood cells just have not been able to sustain to fight off what we would call a blood cancer or a leukemia. So that's just one example of how our immune system can be out of balance. So a balanced immune system, when we talk about autoimmune conditions like lupus and fibromyalgia and rheumatoid arthritis or Hashimoto's thyroiditis or type 1 diabetes, These are examples of our immune system being in overdrive, right? We never want our immune system to be in overdrive, and we never want our immune system to be in underdrive. Some examples of our immune system being under performing are conditions like cancer, hepatitis, HIV/AIDS, shingles, and tuberculosis. Other infections include bacteria, mold, fungus, parasites, and viruses. There are even some conditions where our immune system is what we call hyperreactive, and that's an allergic reaction. It can be to food, it can be to allergies, seasonals, it can be to eczema, asthma, and sinus infection. So the optimal place where we want our immune system is to be balanced. And we're going to talk about how CBD overall puts our body in balance. And that's what we want. We don't want any internal threats or external threats to come in and to cause us to be sick or have an unbalanced immune system. So some examples of autoimmune diseases, and think of autoimmune disease as your body thinking that parts of your body, like your thyroid gland or your skin or your lungs, are attacking itself. And the autoimmune diseases occurs when our own immune cells destroy the body's healthy tissues by mistake, right? And so that is something we never ever want to happen. In fact, I tell this story all the time. When I was in medical school in the early 1990s, I never met a patient or took care of a patient that had lupus. And the only patient, so to speak, that I knew of that had multiple sclerosis was one of my classmates in medical school. So autoimmune conditions were not very common back then, but are very common now. 1 out of every 4 Americans have some sort of autoimmune condition. Some autoimmune diseases that attack the brain are multiple sclerosis, and sorry, this slide is so small. Some blood conditions are one we talked about, like leukemia or lupus, erythematosus, GI tract. There's some autoimmune conditions like celiac disease. Many of you have heard of someone that may have had celiac or has celiac disease. They have a gluten insensitivity or sensitivity. Crohn's disease, ulcerative colitis, diabetes type 1. And then there's peripheral neuropathy or autoimmune diseases that cause the nerves to be out of balance, or your diabetic neuropathies, your peripheral neuropathies. And then the lung can be attacked by fibromyalgia. The skin can be attacked by a condition called scleroderma or vitiligo or eczema. There are some muscle conditions that also can occur, like rheumatoid arthritis, very debilitating. There's some conditions that affect the bone as well, rheumatoid arthritis, and then the thyroid gland, Hashimoto's disease or Graves' disease. So every single organ, in our body potentially can be attacked by an autoimmune disease. And then when we talk about the endocannabinoid system, as you will learn, that we have receptors in all of these major organs to put our body back into balance. Another immune condition or reason why we want our immune system to be strong is this COVID, right? We are not done with this virus yet. So COVID-19, global pandemic, now we're seeing what the virus does, right? Viruses mutate. And so right now that's what it's doing. It's mutating, and we're seeing this Delta variant, that Delta 8 that started in India and now is really causing a lot of problems in states where people have a low vaccination rate. So I'm not pushing vaccinations because that's a personal preference, but just know that is one of the ways to combat this global pandemic. And then I thought this slide was really cute. If you think this slide is really cute, you can put it in the chat. But Delta 8 is the new variant. So can Delta 8 assist with the variant Delta 8? Good question. So the Delta 8 variant looks very much like the original variant from Wuhan, China, and those spike proteins that are coming out of this viral body is really what attaches to our internal organs, like your lungs, your kidney. You know, you hear about people who are on ventilators and then they decompensate and unfortunately die from in-organ damage, where this virus is just looking for a host that is unhealthy to live in. And when it gets in that host, it will replicate and duplicate and do what viruses do. So let's talk about how CBD can improve our immune system. Well, let's first look at the plant, cannabis. And it's important that you understand that when we talk about CBD, it does come from the cannabis plant. But the cannabis plant has two species. And in 2017, I didn't know any of this, right? I didn't realize that cannabis had a species called marijuana that gets you high, and it had another species called hemp that does not get you high. And the reason why hemp doesn't get you high like marijuana is because hemp has a very small percentage of THC, or Delta 9, tetrahydrocannabinol. Big word, right? Took me a long time to pronounce it too, but Delta 9 tetrahydrocannabinol is the compound that is sourced from the cannabis plant that gives you the high, that gives you the euphoria, that gives you the paranoia, that gives you the munchies, if you've ever tried Delta 9. But it's in small amounts in hemp, and that's why hemp doesn't give you the high. But what hemp does have, it gives you a lot of CBD, or cannabidiol. We're going to talk about what that is, what it means, and how it works. But cannabidiol gives you the health benefits without the high. So when you use marijuana, you're going to get high because it has high levels of THC and very small amounts of CBD. But when you take hemp, or CBD that's sourced from the hemp plant, you won't get high because it has very little THC and large amounts of CBD, or cannabidiol. So cannabidiol is one of 180 plus compounds that the cannabis plant makes. But as you can see in this slide, it's really the CBD that has the medicinal benefits that many people are looking for. See, there are people that you know, there are people that I know, there are patients, there's neighbors, there's colleagues, there's so many people that understand that there are alternatives to normal pharmaceutical medications. And CBD is one of those alternatives. CBD not only helps to reduce inflammation, and it helps to reduce anxiety, it helps to really reduce pain, it helps to improve sleep. All of these things we're going to talk about, because all of those things, if they are not in balance, your immune system will be out of balance, and that puts you at risk of getting ill or getting sick. So if you don't sleep well, if you have a lot of stress, if you have a lot of anxiety, if you're depressed all the time, if you've got all this inflammation in your body, that causes the immune system not to be balanced. It'll be out of balance. So we want to get CBD in everyone that we know and we love and care about in their hands, so that they can address those things without having to take pharmaceutical medications all the time. Every time they have a headache, or every time their knee hurts, they're popping a Motrin or Aleve. You know, over time, using Motrin or Aleve, using Tylenol or acetaminophen every time you have an ache or a pain can cause kidney and liver damage. So we want to protect those organs for our lifetime. CBD also inhibits cancer cell growth. And that's really important, right? In our immune system, if we're dealing with someone that may have cancer, if we're dealing with someone that has an autoimmune condition like a leukemia, CBD is not going to cure that, but it can help to stop the progression of those cancer cells from growing or metastasizing. CBD is neuroprotective. We talked about, right, those autoimmune conditions, one being peripheral neuropathy and diabetic neuropathy. It can help to reduce the inflammation around those nerves, even to help those who have neurodegenerative disorders like dementia, or maybe they've had a stroke, Parkinson's disease, multiple sclerosis. All of these conditions, CBD can come in and reduce inflammation around the nerve. And if it's caught early enough, can reverse the nerve damage. CBD helps to promote bone growth. You know, we talked about how there are autoimmune conditions that affect the bone, like the rheumatoid arthritis. It helps to reduce blood sugar levels, your type 1 diabetes. So hopefully you can see the trend now on all of the benefits that CBD has as it relates to autoimmune conditions that we talked about in the slide previous. It helps to reduce the function of the immune system. We talked about how the immune system can be hyperreactive in your autoimmune conditions, or it can be underreactive in those people who are immunocompromised. Immunocompromised meaning those are people with cancer or HIV positive, AIDS. An immune function that's hyperreactive are those people who have lupus or multiple sclerosis, fibromyalgia. So it puts the immune system back in balance. CBD also reduces inflammation. It reduces the risk of arterial blockage. So in those folks who have high cholesterol that has led to coronary artery disease or blockage of the arteries, it helps to reduce that blockage. It does it by reducing inflammation in the blood vessels. It also reduces small intestinal contractions. We talked about that, right? Some autoimmune conditions that affect the Peyer's patch, the small intestines, or even the large intestines, like Crohn's disease, ulcerative colitis. All of those conditions can be addressed with CBD. It also reduces nausea and vomiting. So when we're talking about that person who has cancer, who is going through chemotherapy, maybe Zofran is not working, some of the medications we use to reduce nausea and vomiting, CBD can be used to reduce nausea and vomiting in a natural way. It also helps to relieve pain. In fact, CBD is 20 times more potent in relieving pain than your Motrins and your Aleve and ibuprofens without the side effects. It helps to relieve anxiety. We all have a lot of anxiety right now. It slows bacterial growth. It suppresses muscle spasms. It helps to treat psoriasis and other skin conditions that we talked about that are autoimmune related, lupus, erythematosus, psoriasis, eczema. And it's also a vasorelaxant. So it can come in and really dilate the vessels in those who have high blood pressure, in those who may have erectile dysfunction, improving blood flow to major organs. There's other cannabinoids that are important too, like CBG and CBC and Delta-9, THC, and Delta-8, which we're going to talk about a little later, THC. All of these compounds that the cannabis plant produces on a cellular level, when we consume CBD products that we offer here at Wakana, we're able to see a change in inflammation. We're able to see improvement in our sleep. We're able to reduce nausea and vomiting in that loved one who may be undergoing cancer treatment. It helps to stimulate the appetite. If you need a stimulation of your appetite or a suppressant of your appetite, CBD can do that. CBD, because of the endocannabinoid system and how it works, it knows what the body needs. It needs to be put back into balance. So when we think about, let's just talk about a viral infection. It could be the flu, it could be COVID-19. You know, we see many symptoms: congestion, runny nose, cough, diarrhea, fever, chills, headache, muscle or body aches. I want you to get a visual of this slide when we start talking about our products. Because though we can't say our products, we cannot say that our products would help to mitigate or cure COVID-19. But what we can say is that if you know someone with COVID-19, it can assist with the symptoms that they are having. Some other symptoms in COVID-19 is nausea and vomiting, fatigue, loss of taste or smell, sore throat, shortness of breath, or difficulty in breathing. Now, this loss of smell or taste is a really common symptom that we're seeing more and more people suffer from. Unfortunately, my oldest son got COVID and he lost his smell and his taste for a month and a half. Now, we are so grateful that my Jacob is not in some hospital or in ICU. He is still alive and well. So loss of smell or taste for a month is annoying. It was very annoying for him. But when that happens, it just is just telling us that this viral load causes a lot of inflammation. So anything that irritates or inflames the inner lining of your nose can cause this issue, along with inflammation in the central nervous system, where our smell and taste comes from as well. So again, we can't make any claims that our products will cure COVID, but what we can say is that these products absolutely can assist with the symptoms that one can have from any viral, from any bacterial or fungal infection. So CBD is an immunosuppressant, meaning it can reduce the inflammation that occurs when we talk about our immune system, right? And when we look at COVID, now don't look at this slide, a lot of big words, but COVID, when one gets COVID, it is an over-exaggerated immune response. It's an immune response on steroids. Everything is inflamed to the 20th percent, right? And so if you already have inflammation in your body, if you already have hypertension, or you have heart disease, or if you have diabetes, or if you have asthma, if you already have a lot of inflammation in your body, if you're obese or overweight, you've got inflamed fat cells, and then you get COVID, it's like inflammation on top of inflammation on top of inflammation. So what happens is that CBD is an immunosuppressant. It brings down that inflammation so it can help assist to get the body or the immune system back in balance. So that's how CBD works when we talk about not only autoimmune conditions, but when we talk about a condition like COVID-19, which is a crazy cytokine reaction, inflammation reaction of the body, and it's an overreaction. CBD also, as we think about viral infections, we think about bacterial infections, we just think about our immune system. We know that your immune system resets itself when you go to sleep at night. So if you're not sleeping well and you're not getting quality sleep, that's going to cause stress on your immune system. Also, mental stress, anxiety, depression can also contribute to a decreased immune function, right? So you remember your grandma would always say, you know, you just wearing yourself out thin and you're gonna get sick because you're ripping and running, Rita. You need to sit down somewhere. Well, that's where it comes from. That it's really true that when you tax your body and you're not sleeping and you're not wassooing down and you're stressed out all the time, your immune system is now not functioning at its maximum. So we want to improve our sleep. We want to reduce stress. We want to reduce inflammation. Those are like the top 3 things that you want to make sure that you're doing so that your immune system can be strong enough to fight off any infection that may present itself. So how does CBD work on the immune system? Well, there are receptors that are on our immune cells that CBD, THC, all the other cannabinoids bind to and cause a transmission into the cell to put the immune system back in balance, right? We have cannabinoids that our own body produces, anandamide and 2-AG. Our body produces similar compounds just like the plant. But when our body is out of balance, then our body can't make anandamide. Our body can't make 2-AG. That's why everybody needs CBD. Even people who claim they are healthy, they're not on any medication, they don't need that, they don't need anything extra, but they do, right? Because of all of the stress that the environment puts on our body, the air we're breathing, the water we're drinking, the food that we're eating is not really the food that looked like food 30, 40, 50 years ago. So the immune system has receptors that when you consume CBD, it binds to these receptors in the body, sends a signal to reduce either inflammation, to help to get us sleep, to help reduce anxiety. And so this is a really good diagram of that, how the cannabinoids will bind to either CB1 or CB2 receptors in the immune cell, in the nervous system, and send a message to put the body back in balance. Now, a question you may have, and I thought this was a really good article, does cannabis or CBD weaken the immune system? And what they found out in this study, they looked at, I think it was 35 patients who had HIV. They were infected with HIV, and they gave them CBD and or cannabis, and looked at their immune system over time. And what they found was that they were giving these particular patients CBD for nausea and vomiting that the HIV patients were having as they were going through treatment. And what they found was that not only did their nausea and vomiting improve, but their immune system was not weakened at all. So they weren't at risk of getting any other infections that we typically see in people who are immunodeficient. People who are immunodeficient, like people who have cancer, HIV, they're very prone to getting infections very quickly. And so this was just a good study that shows that CBD does improve the immune system and does not weaken it at all. So let's look at how specifically these CBD products can give your immune system a boost, okay? We've got a lot of great products here at Wakana, so you can't go wrong with any of our products. We are the crown jewel of CBD. Again, this FDA disclaimer just states that these statements have not been approved by the FDA. We can't make claims at all, and we're not making claims that these products will cure, mitigate any condition that you may have as it relates to your immune system. So our products are tinctures we're going to talk about first. Our tinctures are products you place underneath the tongue. And why it's so important to be on a tincture every day, think of it like a multivitamin every day, is that you want to ensure that the CBD is in the bloodstream, right? And by taking the tincture every day, twice a day, you will have that steady state of CBD in the bloodstream. So tinctures are taken underneath the tongue, holding it for about a minute so that that CBD can be absorbed in the bloodstream, and that will be a great way to start using products to boost your immune system or to keep your immune system in balance. We have a power line and a pure line. Now, the difference between the power and the pure is that the power contains the legal limit of THC, which is 0.3% or less, and the pure is a broad spectrum product. It contains less than 0.0% of THC. All of the products, I recommend starting low and slow, 3 drops in the morning, 3 drops in the evening. So we have a Power Hempranium 500 milligrams, that's the one on the left. Then we have our Pure 300 milligrams product tincture. We have a water soluble product. We have a product called Hemp MD. It's our most potent tincture for those who have severe, moderate to severe challenges that they want to address in life. And then we have a hemp powered hair tincture. That's a product that you use for hair thinning, hair loss. And we saw that during COVID, right? There were some people who had symptoms of hair loss and their hair didn't start growing back for months, right? And so hemp powered hair is a product that can help reduce the inflammation, because that's all that happened. It was an overwhelmed inflammatory process going on at the hair follicle that caused many to lose their hair. And then we have products that are 5 ml size. They're a smaller size if you want to start with a smaller size product. And then we have our edibles. Now, we want to layer our products. So we just don't want to do the tincture twice a day. We also want to use the gummies, right? The gummies, again, are great products that will assist with sleep, right? So I take a gummy at night. I'm in love with the Delta 8, and we'll talk about the Delta 8 gummies. But we have a power gummy that's in the black label. That's for those who like that small amount of THC. They don't have random drug screens. If they have random drug screens at their job, you want to stay with those pure gummies and those pure products. The products are in the white label. They contain less than 0.0% or less of THC. Gummies take about 30 to 45 minutes to get in your bloodstream. So taking a gummy about 30 minutes, 60 minutes before you go to sleep will help to give you that restorative sleep, that sleep where your immune system can reset itself, right? The pure gummies I've been using on Wednesdays, as you remember, I have to go to a facility where my wound nurse is very challenging for me and my mood. So I have to use my vape, and I take 1 pure gummy about an hour before I go to that facility so that Dr. Rita is nice and calm and pleasant to everyone. Then we have our Flight 50 and our Flight 25 gummies, our Delta 8. We're going to talk about Delta 8, but let's move on to our Flat Belly Brew coffee. We have a coffee that's an edible that contains a broad spectrum CBD. So if you have a random drug screen, you can partake in the coffee. It will help to reduce cravings, so sugar cravings. It's just an overall great coffee to drink because sugar is a culprit, and sugar can cause those who are immunocompromised or those who are undergoing cancer treatment. You know, sugar is a medium where cancer will grow quickly. So we want to make sure that that is reduced, and the Flat Belly coffee helps to reduce sugar cravings, carb cravings, and an overall great way to get your morning started and afternoon started. Our immune defense tea is another great product. It does not contain CBD, but it helps to boost the immune system, make it balanced. It has a lot of great herbs like echinacea, golden seal, root. It's a great, great tea to drink. It's a 4-day immune kind of booster where you're drinking 8 ounces every day for 4 days. We also have our bitter tea, which is another product that is a detox tea. So we have an immune defense tea and we have a detox tea. I think everyone should detox at least quarterly. This bitter is a great way to cleanse the colon, cleanse the liver, and get the body back into balance as well. Our flat belly gummies are brand new. We just launched that after our last conference, 710. Again, the flat belly coffee and the flat belly gummies are a great way to shed weight. Maybe you want to maintain your healthy weight, but it's going to help to reduce those cravings as well. So we talked about Delta 8. Delta 8 is something you should know about. It's a new cannabinoid on the block. It's very popular, and it's popular because it's a cousin, very close cousin to Delta 9. Now, Delta 8 is legal. It is not an illegal substance, but it gives you more potency than CBD. So if you are a connoisseur of Delta 9, you like Delta 9, you've had Delta 9 maybe when you were a teenager, and you're looking for that potency without a high, Delta 8 is going to be your best friend. Delta 8 also improves creativity. I've met a lot of people that use our Delta 8 products that say that when they need to get something done, it may be a very important project, that they're able to get those creative juices flowing. Delta 8 is also very calming and relaxing, and that's what I love without the high. So Delta 8 improves sleep, improved appetite, you'll notice. You'll notice a reduce in anxiety, a reduce in stress, improved brain health. It has great neuroprotective properties. It helps to manage pain and inflammation, just like CBD. It helps with nausea, and it just improves your overall well-being. So Delta 8 absolutely is a product that you want to use if you like Delta 9 and you want to help with your creativity. It also supports and enhances sex. It supports sleep. And it's slightly energizing. You know, there are many of my clients that have noticed an increase in their energy level with the Delta 8 gummies. And then we have a new Delta 8 pre-roll. How many of you have tried the pre-roll? Put it in the chat. Let me know how you're liking that pre-roll. It's a Flight 300. It is Delta 8. So like with all of our products, you don't need a lot. I meant to mention that with the gummies, you want to start with a quarter of a gummy, Delta 8. That's all I can handle is a quarter of a gummy. With our Delta 8 pre-roll, it is a great product that works quickly. So if you're looking for some relief to stress, anxiety, inflammation, pain, our Delta 8 1 to 3 pulls on that is all you need. You don't need to smoke the entire pre-roll in one sitting. We also have cartridges. You know, the cartridges are really popular. I love the cartridges. They work quickly within 1 to 5 minutes. Our hypnotic vape cartridge, our Raspberry Jane, are very popular. I like the hypnotic vape oil cartridge because of the peppermint. I love peppermint. So I use this before I go in that facility on Wednesday to deal with that wound nurse. And we also have Delta 8 cartridges in different flavors. And then we have our CBD pre-roll and our premium flower. So see, we have something for everyone, be it a millennial, be it a baby boomer. Smokables are fast acting. So if you're looking for something within 1 to 5 minutes, absolutely you want to have this on hand. So right now you've got the tincture in your system, 3 drops in the morning, 3 drops in the evening. You've got your gummy at night, or maybe you've got your gummy during the day to help reduce anxiety and stress, and then you have your smokables. I've already acknowledged that I think I forgot the topicals in my slide deck tonight. Shame on you, Dr. Rita. But we also have culinary products. We have spices, we have garlic fire, we have Flavor King chili lime, yeah, infused with CBD. We have a vegan butter, yep, infused with CBD. We have a Culinary Plus tincture, yep, infused with CBD. So you can bake and cook your favorite recipes as well with CBD. So the Culinary Plus is a great product because it is a product you can use as a tincture, or it's a product that you can use exclusively when you're baking or cooking your favorite meals. What we found is that there's some people are sensitive or don't like the taste of the turmeric, black seed, and peppermint that's in our Hempranium 500 milligram formulation. So this is a great product for those who don't want that additional taste or flavors in a tincture. So just so you know that. And then this article talks about how many Americans are saying they're having more sex more frequently since they were quarantined for so long. And what's really interesting is that we've seen a boost and a boom in our babies that we're delivering, right? Many more COVID babies are coming. So we have products for sexual health. We have products that help boost the libido. It helps to reduce vaginal dryness in our menopausal and postmenopausal women. Or maybe it's, you know, you're a woman that not having any problems, but you want to enhance the sexual encounter. We have body butters as well that are all infused with CBD. And then we have our King of the Jungle gummies. These are great full spectrum gummies for men or women that want to have more stamina. They want to improve their libido. They want to reduce the inflammation, because remember, CBD is a vasorelaxant. So if you're having any blood flow issues like erectile dysfunction, then that will be a great addition to your toolbox. And then we have hair products, because we know again that the immune system can cause hair loss. When your immune system is not operating optimally, you can have hair loss. We see it in patients who have lupus. We see it in patients who have had COVID. We see it in patients who have cancer. You know, their hair loss is typically from chemotherapy. So as long as you have a hair follicle, these products will help to restore hair thinning, hair loss. It will help to maintain a healthy head of hair. That's our Save Our Strand hair care system. And then essential oils are also something that we offer, because essential oils have been used for centuries to improve and maintain our immune system. We offer tea tree, lemon oil, black seed, peppermint, eucalyptus, frankincense and myrrh, essential defense, first defense, and peppermint spray. Let's talk about first defense, because, you know, these viral particles enter through your nose, right? And so this is a nasal spray. Not only is it full of a full spectrum CBD, but also essential oils like rosemary, cinnamon, basil, lemongrass, peppermint, eucalyptus, lavender, and clove. All of these essential oils, along with the CBD, help to protect the entryway of many viral particles. So I love this spray. It is great to have on hand. A lot of people are using this spray, again, to maintain an optimal immune defense for anything that can come against us. Now, these are some other lifestyle modification, lifestyle things that we want you to do when we talk about our immune system being boosted. Zinc, making sure that if you are not eating these foods, that you are taking a zinc supplement. Vitamin C, if you're not eating these foods, I take, in addition to these foods, vitamin C supplementation as well as zinc. Iron, very important in having a healthy immune system. These are some foods like lentils, spinach. I love spinach. I could eat spinach every single day to aid in your immune system. Vitamin E, you can get that through nuts, seeds, wheat germ, green leafy vegetables, avocado, and shrimp. Really important. Vitamin A, red bell pepper, spinach, vitamin B6, green leafy vegetables. So all of these supplements are really needed during this time, and even when we're not in a global pandemic, just to have an overall strong immune system. We have a sister company, Royal Defense. We want to keep our hands and our surfaces safe and clear from any viral, bacterial pathogens. We have our virus defense hand and surface sanitizer. We even have a sanitizer for produce, for your meat, and for hard surfaces. We have a cute little travel bag. I've been traveling a lot back and forth, building in Florida, so it's a great way to have those masks readily available, and the spray that when you're on the airplanes you can absolutely use. Now, what I love about our product line is that you can save a lot of money. You don't have to buy these products a la carte. We have packages that really will save you money than buying a la carte individual products. So we have a defense pack, comes with that immune defense tea, along with first defense, essential defense, and those other essential oils. We have our flat belly gummy challenge pack that comes with the flat belly gummies, the flat belly brew, and the bitters, another nice package. We have a freedom relief package, which comes with the power gummies, the Hempranium MD, one of my favorite because I left out the slide, the topical slide, but the extreme relief as well as the liquid relief roll-on. These are topical products. The extreme relief is a cream. It's offered as a topical product in this relief pack, along with that Flight 300 pre-roll. We do have 4 different topical products for inflammation and pain. The liquid relief is Dr. Rita's Rub. I like it because you can just roll it on very quickly, carry it in your pocket like I do at all times. We have the Power Relief Cream, the 400 milligram or the 200 milligram, and a Power Relief Cream that's 500 milligrams. So we have a great product line for topicals that I unfortunately left out of this slide deck, but just know we have topical products. Then we have a 710 Freedom pack. This is a great pack. Has an assortment of a lot of products. It's retailing now at $16.05. These other packages will run you about $300. This Father's Day package is a great package. It'll run you $119, but you're saving 35, 40, 50% when you buy in these packages. The Father's Day includes Power Hempranium, CBD liquid relief that I showed you here. I love this liquid relief. It comes with a bottle of the Power Gummies, a Diamond Pre-Roll, a CBD joint, and a 4-pack bonus King of the Jungle gummy. So great, great packages you can get. We also have customer pure packages. Maybe you're someone out there that cannot take our power products because they have a little bit of THC. You have random drug screens. Don't worry. We have a package for you. This package comes with 2 of our pure tinctures, our broad spectrum gummies, as well as our empowered hair that you can use topically. Any topical product will not pass the blood-brain barrier and will give you the relief you need. It comes with 2 of the Extreme Power Relief Topicals, the 400 milligrams. So this is another great package, as well as our Customer Variety Pack. This is a great package that combines our power with our broad spectrum products. Again, a lot of these packages make sense to buy because you're getting savings in upwards of 35, 40, 50% savings. So you can't control the virus when we talk about this virus, the coronavirus, but you can control the host. You know, we can control what we're putting in our body. We can control the fact that we understand after this webinar how CBD can assist with symptoms that something like the coronavirus or COVID-19 can cause, right? An overcharge of inflammation in our immune system causes a lot of stress and anxiety. That causes us not to be able to sleep. It causes muscle aches, right? We've got these topical products to address that. We've got products to address the insomnia. We have products that will address inflammation, the tinctures, the gummies. So hopefully you can see how CBD, yes, can assist to improve our immune system, to keep our immune system strong. So if we are and have or maybe will encounter the COVID-19 virus, that our body is prepared and strong to fight and ward it off. So I'm going to take questions now. That is the end. Sorry, I forgot the topical slides, but just know we have amazing topical products as well. So we're going to have you put your questions in the chat. I'm going to move my medical advisory board over, and I'm going to move Maggie. Maggie, I'm going to move you over because you wanted me to give this presentation tonight. You may have a specific question for me as to why you wanted me to present this amazing topic. If there's any other medical advisory boards on the other side, I'm going to move you over. I think I got everyone. And let's see what sort of questions we have in the chat. Oh, Erica Zachary, you can't keep that garlic fire in your house. Your son puts it on everything. I love our spices. They are amazing. Delta 8 helps my neuropathy. Erica Zachary is saying, I just received my package with my Delta 8 pre-rolls today. Cannot wait to try it. I cannot wait to hear what the results are like, Erica Zachary. Gia is saying that something gives her energy. Let me know which one gives you energy. Yes, Delta 8 is in the same legal category as CBD. Do you utilize CBD with your pregnant patients? Yeah, I do. I do utilize it with my pregnant patients. A lot of them use the topical products to help with discomfort. But if you are pregnant or nursing on the line, if you're under a doctor's care, please talk to your OB-GYN, right? Because I'm not your OB-GYN, but you need to talk to your physician as well. Oh yes, so the Delta 8 gives Gia energy. Thank you for clarifying that. Wonderful. Well, it's 8:54. We still have 6 minutes. Is Maggie on the line? Any of the speakers? Dr. Kim, Erica Zachary, you can chime right on. Where did Magnolia go? Hi, Erica Zachary. Did you want to say something?
I do. Actually, today I'm not going to give a testimony about myself. I think people have heard a lot about me and MS, but I use the products all the time, and I'm just grateful to have them in my house because it's helped me in so many ways, controlling muscle spasms and trying to address all of the symptoms that I have from MS. And right now I'm still working. That's why I had 2 screens up. So in controlling the anxiety and all the things that I'm feeling just because I'm still working and it's almost 10 o'clock at night.
Oh my
But
gosh.
I wanted to share about my daughter actually, because she had a testimony. She's actually in Puerto Rico right now and was really afraid that she was going to have to go. She had been having back pain. She has it. I need to talk to somebody. She needs to talk to somebody because she has back pain. I don't know if it's seasonal, but a couple times a year. And she was on her way to Puerto Rico, which is where she is. And she was afraid that she wasn't going to be able to go, had spent her money and did all of that kind of stuff. She has been having chronic back pain. She was having it for 3 or 4 days. And so she stopped taking the power related products that she had been taking in the past because now she's a nursing student. She didn't want to get tested and have that show up. We know it's not much, but just in case. And so she started had her use the topical on her back, had her use the pure Prio tincture and the gummies for about 3 or 4 days before she left Tuesday. And I was afraid, but then we were using a massager as well and trying to, drinking water and doing all that kind of stuff. But she didn't have any back pain when she left. I was just grateful because I didn't want to have to worry about her being and not being somewhere else all the way in Puerto Rico with nothing to help her with back pain. So just grateful to have the Wakana products in our house to be able to share all of these products with my family because we all use CBD on a regular basis. So yeah.
Wonderful. Thank you so much for sharing that. Yeah, I tell the story all the time. My 3 adult children, they fight over the gummies. Like, what are you doing screaming down there over gummies, right? Dr. Lee Fry is an OB-GYN. Awesome. Yes, Dr. Lee Fry absolutely would recommend CBD to pregnant moms. I work in the inner city. 99.9% of our pregnant moms come in and test positive for THC, right? And they're getting the THC from Lord knows where. And they're taking THC, top 2 reasons, nausea and vomiting and anxiety, right? So we know what they're putting in THC when our patients are buying it from Lord knows where. They're buying it from the person down the street. And what we're finding now, and it is an epidemic, we're seeing fentanyl, we're seeing rat poison, we're seeing some very dangerous fillers that they're using in marijuana now. So absolutely, if you have a patient that has issues that CBD can assist with, um, sciatica, a lot of our pregnant moms have, low back pain, all of those discomforts where we tell our patients to take Tylenol, right? And we don't need to have them do that if we have an option in the toolbox, which is CBD. So thank you, Dr. Kim, for letting me know that Dr. Fry is, my colleague, is an OB-GYN. Okay, so there's a series of questions in the Q&A section. Thank you so much. Oh, I don't see them though. Oh, here they are. Okay. So we have a question from Angie Dickerson. A nurse asked me if we have any products with only CBG products in them. We don't have any isolates of CBG only yet. CBG is another new cannabinoid on the block. CBG is being used a lot for GI issues, gastrointestinal issues, ulcerative colitis, Crohn's, reflux. There are some CBG isolates that are also being tested and used for glaucoma. So it's going to be a product that you're going to see and hear more about at Wakana. So just know that's coming. But no, we don't offer any CBG products. Please confirm if the flower strand has the same exact strand inside the pre-rolls. Yes, it is the same strain, the pre-roll, CBD pre-roll, as our premium flower. The strain is called Electra. It's a very energizing sort of strain of CBD from cannabis sativa L, of course. Will we be creating a product flower with only THC in them, no CBD, for those who are looking for that straight euphoria high? No, we will not be offering any straight THC products for those who are looking for that straight euphoria high. If you're looking for something that is very similar to THC, it's our Delta 8 products. Absolutely. For all of those who are looking for that sort of feel, you want to direct them to the Delta 8 pre-rolls, the Delta 8 cartridges, and the Delta 8 gummies.
Dr. Rita, do you see this? Do the products work for pets and dogs?
So we don't do products for pets and dogs. We only do products for humans. So what we're looking for is a veterinarian. Dr. Rita doesn't do pets. I don't know the first thing about dosing a pet. So we need an expert that understands the physiology and pathology of pets, which I'm not that person. So all of my business partners out there, let's get some veterinarians involved with Wakana, and then absolutely, then we can go down that path. So this is not a valid threat. There is no way for anyone to test for CBD. Urine drug screen test for THC, not CBD. So her employer cannot legally make that type of threat. Correct. That is so correct, Dr. Kimberly Smith, that employers are not checking for CBD. Urine drug screens test for THC. I'll leave number 3, since no company's main objective is to provide CBD legally, which means less than 0.3.
I was just letting her know that I was answering some of the questions and you were going to come and answer that one for her.
Okay.
That's all.
Did I answer the questions?
Yes, ma'am, you sure did.
Okay, wonderful. Yeah, that's so important to understand. There's a lot of people threatening employees about CBD. It's really sad, you know. You could come to work and take Vicodin, but you can't come to work and take CBD, right? I mean, it's like,
Yes.
Yeah.
who
Crazy.
for Vicodin or any other opioid or pain medication that you might have been prescribed for your migraines or your surgery that you had last month.
Yeah, I have lots of friends that work for the federal government that are terrified to get involved.
Yeah. It's really sad. It's really sad.
You have a
Do
question
you see
for
the
Ernestine
chat?
Davis
The other
here.
question?
Yeah.
Yeah. Would like more information about CBD and weight loss. So CBD is very, very fascinating when you look at the data and research about how it helps with weight loss. CBD actually helps to turn the white fat into brown fat. So it's that brown fat that increases the metabolism, helps to reduce that body fat. And then we have other herbs that we combine with our CBD coffee and our CBD coffee in the CBD gummies that help to reduce cravings for sugar, cravings for refined carbs, gives you energy, helps to increase your metabolism and reduce fat storage. Some of those ingredients include Caralluma. Caralluma is from a cactus in India. That is a very important part of our flat belly gummy. It also has berberine, which is another herb that is used for weight loss along with the CBD in the gummy. It has chromium, and it also has Caralluma, berberine, chromium. Those are the 3 top ingredients along with the CBD that helps you to achieve weight loss. So a lot of research, a lot of data, it works. We've got people that have lost 20, 30, 40 pounds with our bitter challenge. They've combined the bitter tea along with the flat belly gummy. But guess what? They had to change their diet and they had to start doing some exercising. Don't think that CBD alone is going to do it, right? It's a collective thing that has to happen with your diet, with your exercise, and these amazing products. Wonderful. Someone asked what product is good for her 42-year-old with multiple sclerosis. Did you answer that, Eric?
No, I just sent her a message asking her to send me an email so I can talk to her directly.
Perfect.
There was a message from Ernestine Davis. I've been encouraging people to sign up for the gummy challenge. Will there be a Q&A? People have questions.
Oh, will it be a Q&A before the gummy challenge? Absolutely, yes. Absolutely, yes. We're going to do it just like the bitter challenge where we have a Q&A. Thank you, Ernestine Davis. Yes. Any other questions?
I don't see any
So
other.
for all of our guests, let's see if there's anything. Nope, there's nothing here. For all of our guests, what we want is for you to connect with the person that invited you so you can get those products ordered, either those packages, which make a lot of sense to get one of the packages, or you can order a la carte as you please. But we're excited to have this webinar every Wednesday. We talk about a different subject. So if you have a subject that we haven't talked about and you want to hear more about it, just email me. My email is ritamd@wakana.com. So I'm going to put it right in the chat, ritamd@wakana.com. Did I answer all your questions, Maggie Carter? Maggie Carter is the one.
Yeah, hi. I didn't actually have a question, except that I do have a potential customer. No, she is a customer that was asking me about metformin
Okay.
with
About
the
metformin.
gummies. She wanted to know, like, the flat belly gummies.
Right. So the flat belly gummy doesn't have the sugar content like the other gummies. Our other gummies contain 2 grams of sugar. The flat belly gummies do not contain sugar. So for diabetics, obviously we're trying to lose weight on the flat belly gummies. There's no sugar. So great question. Diabetics can take those gummies. Yes.
Thank you. And
You're
thank you for covering the subject today.
You're welcome. Anything for you, Maggie. So that's my email, ritamd@wakana.com. Email me your questions, your concerns, your critiques. I love getting constructive criticism, right? Let me know what you want to hear, and we will tackle it. Wonderful. Thank you, everyone. So be well, be safe. Thank you, Medical Advisory Board, Erica Zachary, for tuning in, Dr. Kim Smith. Thank you so much for really always being here, supporting the Medical Advisory Board is amazing. They are so amazing. Thank you, business partners, for always showing up on Wednesday. And thank you, guests. Thank you for tuning in. We hope to see you next Wednesday. If you want to hear more about the opportunity, you want to tune in either tomorrow, Thursday. Well, that call is for millennials, but if you're a baby boomer, you can join. And then Saturday, we have a business overview as well, Saturday at 10 a.m. Connect with the person that invited you. They can give you all the links. They can give you their website address so you can get your products ordered, you can get your questions answered. Be well, be safe, and have a great rest of your week.